If you're in family medicine, internal medicine, if you're a specialty physician, nurse practitioner, or PA, seeing patients in the clinic on a regular basis, I'm sure you're seeing patients with diabetes, blood pressure, heart disease, heart failure, CKD, obesity, dementia, depression, all of these chronic conditions. Imagine you have a patient who has mild cognitive impairment and they're trying to see if they're going to progress to dementia. And if they do, what medications they should be on. Do you know how to differentiate between the different kinds of dementia, such as frontotemporal dementia, Alzheimer's, Lewy body dementia? Do you know the workup, the new medications, the blood-based biomarkers to choose? What about a patient who has resistant hypertension already on 3 or 4 medications? What's the initial workup you should use? Should you check for aldosterone problems? Should you check for cortisol problems? FeO? Should you check for sleep apnea? Or what's the order you should progress that in? What are some of the newer medications that have been recently approved for resistant hypertension? What about your CKD patients, those who have mineral issues or they have electrolyte issues? How do you prevent progression of disease? And when they do progress, how do you make sure you get them into the nephrologist at the right time? What about your depression patients who are treatment resistant on 3 or 4 drugs? What are the first-line drugs? Should you combine 2 first-line drugs or should you add an antipsychotic? When you have them finally controlled, should you wean? And how do you do that weaning process? When should you refer patients that are really treatment-resistant depression for ECT or ketamine? Is that even appropriate? What are some of the latest guidelines for obesity? What are the new drugs that just came out for obesity this year? At CME Travel Academy, we do all of those conditions and much more. I'm Dr. Pillay, one of the co-founders of CME Travel Academy. Come join us at one of our upcoming conferences in Las Vegas, Disney World, or New York City this year. We offer 12 CME credits, including ethics, and we'll help you manage all of those conditions in the clinic. We offer one-pagers to be able to help you understand what you learned and be able to use that information in clinic. We also offer spaced repetition questions to be able to remind you what you learned during our conferences. We have custom CME programs, on-demand CME programs, virtual programs. Anything you want to do to be able to help you travel and learn, we're there for you. Come join us at one of our upcoming conferences or choose our CME live stream or our custom CME options. Our goal is to help you practice evidence-based medicine that's patient-centric and guideline-driven, and be able to travel and learn.